to identify ways of diagnosing the ischemic problem, if it is a problem, or rule out the sort of ischemia case. So the options that the guidelines give us are quite good. We can use non-invasive tests such as stress echocardiogram or cardiac MRI perfusions to look at the response of the heart, and with cardiogram a fairly good sensitivity and specificity. Cardiac MRI perfusion scan is also quite and specific, and of course the other option, image directly with a computer non-invasive to look at the anatomy itself. And I have added here something we normally do as a routine in patients in whom we want to rule out dynamic changes in the coronary arteries, which is coronary physiology test and acetylcholine injection during the angiogram. But in general, this is done in more sort of specialized centers. So the non-invasive test listed here and the imaging, the computerized angiography, are good options in this particular case. So I'll summarize briefly what these tests showed. The stress echocardiogram showed inferior transient myocardial ischemia. The cardiac MRI showed coronary microvascular dysfunction, sort of this rim in the subendocardial region of ischemia, suggestive of microvascular dysfunction. And the test we did angiographically with injection of acetylcholine showed mild coronary artery spasm in the right coronary artery, and she had no coronary artery disease progression. The stent was absolutely fine, and we could not see any further abnormality in the coronary angiography. So now we know that this patient has myocardial ischemia, that there has been no progression of the coronary artery